Welcome to this broadcast. My name is John Jacob Curia. Our sign language interpreter tonight is Lensa Odingo. And of course, Safina Cheng is not with us, but she will be joining us on Sunday. Now, to kick us off, the government will not rush to introduce stricter measures against COVID-19 following the discovery of 3 cases of the Omicron variant in the country. Health Cabinet Secretary Mutahi Kagwe, however, says Kenya is currently engaging South Africa and countries where the variant is spreading very fast on how to contain it. 3 travelers who arrived into the country from South Africa tested positive for the variant, have been placed under isolation. As Janae Karisa now kicks off our bulletin with a story.
2 Kenyans and a South African have tested positive for the Omicron variant upon their arrival at the Jomo Kenyatta International Airport from South Africa.
We have a lot of other samples that we are sequencing. So in the next 2 days, I will be able to confirm the spread or otherwise of the Omicron variant in the country.
The 3 have since been put under quarantine as health officials heighten surveillance.
So far, the hospitalization cases that we have in our country are still Delta. We have not detected any Omicron variants in our hospitals.
Health Cabinet Secretary Mutahi Kagwe says lockdown is not an immediate option, but the government is consulting on how to deal with the possible spread of the variant.
The Omicron variant is likely to be the dominant variant, not just in our country, but across the world. And we are happy that the management of the variant globally is now being handled in a better way. We are not announcing a lockdown. We are not announcing curfew hours. This is something we are observing, and in the next 2-3 days, we will be able to tell the country whether it is necessary for us to go back to some of those measures.
Kagwe has urged counties to ready COVID-19 isolation facilities to contain the disease.
We are not forcing anybody to be vaccinated. However, we must recognize that internationally, there are mitigating measures that have got to be followed.
We are ready. We are confirming that our oxygen plants are functional and the ICU beds are ready.
Kagwe says that though the Omicron variant has a high infection rate, the only saving grace is that a lot of people are not getting severe illnesses.
I can predict that it's a matter of time before there is a wider spread of this virus in the country. The question is whether it will spread amongst people who have been vaccinated, in which case it can easily be contained, or whether it will spread amongst people who have not been vaccinated, in which case we are going to have high levels of hospital occupancy.
Juni Karisa Mbele from Mombasa County for the Prime Edition.